Do I need an x-ray or an MRI for my shoulder? This is a question that I get asked a lot of times by my clients or soon to be my prospective clients or those who are interested, because it makes sense, right? Why would I want to go see a therapist or a chiropractor if there's something that's really wrong in there? What if it's something that really can't be fixed, especially by a therapist? Why waste my time? What if I need surgery? And so these are all really good questions that I think are going through people's minds when they're feeling pain in their shoulder. I'd like to kind of give you some ideas of why you may not want to get an x-ray or an MRI right away. And it's going to be based upon research and a lot of the studies that are out there that tell us, you know what, maybe we shouldn't be so quick to go get that x-ray and MRI. Maybe we should see a movement specialist who can really pick apart from morning until night all the things that might be contributing to the pain, instead of just looking at what we call a pathoanatomical diagnosis, which is like a rotator cuff tear or impingement, which is what you only see, on an MRI or X-ray. So let's kind of get into it. And I'm going to use my buddy, Mr. Anatomy Model, to kind of help walk you guys through some of these thought processes. Okay. So first off, again, we're going to be looking at the shoulder here. Now, I want you guys to know that up to 70% of people, so 7 out of 10, will eventually have shoulder pain, okay? In fact, at any one point in time, nearly up to 30% of people will have shoulder pain. So if you went to the entire community that you live in and they all sat in front of you, they could potentially have pain in the shoulder, up to 30% of them, okay? Meanwhile, as many as 30% of people are unable to perform even everyday tasks. And that's a lot. Now, if you think about it, x-rays are primarily to rule out what? A fracture, okay? So most often, if you were to have a fracture, just as an FYI, it would be in what we call the proximal humerus, okay? In fact, up to 50% of the time, the fractures are here. They're most likely due to a fall, particularly in the elderly, especially if you've been diagnosed with osteoporosis. So if you've been frail and you fall and there's been sort of a traumatic event, that might increase the likelihood that you have a hairline fracture or fracture, okay? Now, swelling is a key distinguishing factor, and you would see a lot of swelling. It's not necessarily just muscle tenderness. You might even see isolated bruising. Now, if you're thinking to yourself, I haven't fallen, I just have this shoulder pain that seems to have come out of nowhere, the chances are you don't have a hairline fracture or a fracture. In fact, hairline fractures may not even show up on the x-ray, which is our first line of defense. It's good also for like benign tumors or cancers, right? It might pick up at that. But if you're thinking, man, I just hurt my shoulder, something's wrong with it, an x-ray really is only going to rule out a hairline fracture or a regular fracture. And it'll only show a hairline after 2 to 3 weeks. That's 2 to 3 weeks after you have had that potential hairline fracture is when an MRI would show. Okay? Now, let's talk about an MRI for a second. So, MRIs are really the next best thing that orthopedic doctors commonly go to in terms of, giving people more information and education on what's potentially wrong. It's called the gold standard for addressing soft tissue, ligaments, muscular problems, etc. But check out this fun fact. All right, so if you're older than the age of 60, they found that up to 65% of people will have a rotator cuff tear. And this study was done in an asymptomatic set of group of people, okay? So granted, not everyone that is watching this is 60 years old, but heck, if you do the math, if you extrapolate the data, if you're 50 years old, it could be something along the lines of 50% of the people still have a rotator cuff tear. But it doesn't mean that everyone that's 50 or 60 or getting older has shoulder pain, if you think about it. In fact, they noted between the age ranges of 45 and 60, they found, and this was based upon the study where 2 radiologists who were fellowship trained, so these are really smart radiologists, those 2 both looked at all of the asymptomatic individuals that were between 45 and 60, and they saw that between 55 and 72% of people had labral tears. And that's something that usually pops up as well in an MRI. Well, it looks like you have a labral tear. But then you could go, well, shoot, these people were the age 45 to 60, they were asymptomatic, meaning they didn't have any pain, and 2/3 or more showed up with a labral tear. Okay. Here's something else to really kind of to chew on and think about. 50% of all people with shoulder pain will recover within 6 months. But if you think about it, 50% of people are still going to be having pain 6 months later. Okay? Let's kind of go into maybe the complexity of why that is. So there are 4 joints involved with the shoulder. Okay? So there's the glenohumeral joint, which I'm kind of isolating right here. There's the acromioclavicular joint, which is where those two bones meet. There's the sternoclavicular joint, which is right in here. And there's also the scapulothoracic joint, which is actually the scapula. It's not truly a joint because it sits on the rib cage, but that's actually a really important role player in your ability to have pain-free. And then in addition to that, there are 17 direct muscles that play a role in keeping that shoulder joint in the proper position. Like some of you may notice that you have forward shoulder position. So that shoulder doesn't necessarily sit right. It's like it's sitting too far forwards, and you might even feel that. And really, it's nothing more than a tug-of-war game where you're just trying to keep that shoulder sitting right where it needs to in the middle of the socket. But, muscles like the pec minor and the pec major, or these muscles that sit in the front, a lot of you are driving a lot, sitting at the computer desk all day. These muscles get really tight and they pull the shoulder forwards. So the shoulder is actually a very complex area, and it's not going to necessarily show in an MRI the neurological problems, the mind-muscle connection, where we really deal with the quality of movement and all of that. So, should you move forwards, I think you should really find someone that picks apart from morning until night everything that you're doing. The way you sleep, the way you're sitting, like at work, your standing posture, the way you drive. If you're a woman, the way you're carrying a purse. If you're a guy, the way you're carrying like a book bag all the time. Have you developed old bad habits, potentially based upon sports you used to play, or injuries, surgeries, and compensations that you've had in the past? Let me give you this quick analogy. So this lady I was working with, I was analyzing her gait, and I looked at her, I go, "You look like you're walking like a model." And it was like a 6-year-old woman. And she goes, "Well, I was a model for 20 years. And the point there is that if you've done something for a long time in the past, your body's still going to remember that style of movement. So based upon injuries or that old high school injury that might have happened, your body's probably still acting like that injury is still there and potentially causing you to compensate. So in addition to old bad habits, any sports that you play, weightlifting, the form in which you're doing all those need to be assessed. So before anyone goes out and gets an X-ray or an MRI, I just want you to think through some of those research-based epidemiological stats and facts, and make sure you find someone that really cares about you, that gets to know you and analyzes really from dawn until dusk your movement style, your quality, and analyzes any compensations you have, and therefore then you will find the true root of your pain. I hope that helps. Thank you.